Chinese medicine has been for me the fulfillment of a search for a congenial system of healing. It is a personal, subtle, gentle, yet highly technical medical system which allows me to be close to the essence, to the life force, both of my own and that of others. It's a masterpiece of harmony, intricacy, and movement, which never ceases to engage me, never ceases to fascinate me and intrigue me. How did you come to discover that toxicity is a major problem affecting the general population right now? Well, as I started to say, basically I've learned this from my patients. And what happened somewhere in the 1990s, sort of towards the end, I don't remember exactly when, in my office, I began to encounter qualities on the pulse that were once considered unusual or rare that started to becoming basically common. And this quality was called choppy. And the interpretation of this quality since ancient times has always been blood stagnation. And so I began to wonder why this particular quality, after a few thousand years, was suddenly becoming common instead of rare. And so this was also around the time of the first Gulf War and the returning veterans from that war who began to complain of what they called the Gulf Syndrome. This was the veterans, the soldiers and civilians who came back from the Gulf. And they had symptoms of fatigue, muscle pain, cognitive problems, rashes, diarrhea. And it was interesting that similar symptoms occurred in the veterans who returned from Vietnam, in addition to having depression and the post-traumatic stress syndrome. There was a lot of functional impairment. They were beginning to be homeless people. There was a lot of suicide, alcoholism, and drug addiction. And all this was occurring again after the first Gulf War. And so these were the general symptoms, and at first this was ignored by the government, and they all put it down to people essentially making this up and trying to get benefits. But gradually the attitude changed over time. I became interested in why would all of a sudden, coinciding with these symptoms and this syndrome, were people developing this pulse, which essentially was saying that there was an increasing blood stagnation. And so I encountered articles that were describing how toxicity actually kills people. And apparently most toxins, there are nerve toxins, but most toxins, snake bites, insect bites, kill through blood stagnation. They coagulate people's blood till they no longer have a circulation. And so this is what we were beginning to see. And the value of this diagnostic system is that you begin to pick things up at a much earlier stage, actually sometimes before they actually create symptoms. So it's a very sensitive instrument. Interestingly enough also, that in Vietnam we had Agent Orange, which I think everybody's heard about, which is a very powerful defoliant. And people coming back from Iraq and Afghanistan have been having the same complaints as the people who had the Gulf War syndrome. So what occurred to me then is that something is affecting people who were exposed in these particular areas that involved combat to substances that were toxic and potentially fatal. But it seemed also this was beginning to occur not just in people who returned from war zones, but in the general population. In other words, this choppy quality began to occur in grandmothers and children and people who had not been exposed to these substances that they were exposed to during in war zones. And so the thought began to occur to me that not only were veterans and soldiers being exposed to this, but the general population is being exposed to toxicity that's causing, potentially serious conditions with very similar types of complaints. Over the years, increasingly, people have been complaining about conditions that we allude to as deficiency, and chronic fatigue, fibromyalgia, all the autoimmune types of diseases, increases in cancer, autism, all of these things that we basically associate with something that's depleting the organism. And so it occurred to me that there are other substances, other toxins to which we're all being exposed to all the time. And some people naturally are more vulnerable than other people. Some people are going to be affected sooner than others. It goes back to the old saying that we're not all created equal. So we're not all going to be on the same becoming ill at the same rate, at the same time, even though we're exposed to the same things. Then, about 10 years later, I began to notice another new quality on the pulse, which was something we call leather hard. Now, this was even more rare. In fact, I don't think I only encountered it a few times in my life. And when I first began to feel it more often, starting around the year after 2000, maybe 2002, 3, and then increasing since that time. And this was also noted by other people as well. But I could not identify where I had felt this quality before, but I knew I only felt it a few times, and the other people who felt it had never felt it before. And then it occurred to me one day that the times I'd felt it were in patients who were undergoing radiation therapy for cancer. And it was completely identified with that course of treatment, that is, radiation. And so it began to occur to me that not only were people who were being treated for cancer with radiation being exposed to radiation, but the population in general was beginning to be exposed to radiation. And so the question came, where was this radiation coming from? That we didn't see any alien spaceships or anything on the horizon. And it just so happened at that particular time that I watched a television show, which I very rarely do, in the middle of the day. Why or how I happened to turn the television on. And it was a hearing. It was a hearing in the Senate, United States Senate, was holding a hearing, and it was holding a hearing on radiation. And it was actually not radiation, but so much the effect of cell phones on general health. And so they had invited people from Sweden, several professors from different universities. I think one was from Penn State, one was from Albany, and a few people who had stories, encounters from the general population, and somebody from the federal government, United States. The people from Sweden, these are all professors, medical people with high degrees and positions in Sweden, who reported that the cell phone was invented in Sweden in 10 years prior to this hearing. And the hearing was around 2010, I would say, somewhere in that vicinity. And that within 10 years after inventing the cell phone, which was first used in Sweden for 10 years before it moved to other populations, they noted an enormous increase in the incidence of brain cancer. And so they began to make a connection between people holding these cell phones near their head and the enormous incidence of brain cancer. They then had these two American professors also give evidence supporting what these Swedish doctors were saying. And then they had a patient who described what happened to her husband who had died. Somebody who had a cell phone very early on. He was a professor in California, I think at Stanford or somewhere, and was on the phone a great deal, a cell phone, many, many hours a day. And he developed brain cancer, and he died. And then came the American, the representative of the federal government, who said that there wasn't enough evidence and just basically dismissed the whole thing. And that was the end of the hearing. But that impressed me a great deal. And then I began to realize that, this is a microwave radiation, and that we were encountering it everywhere. Televisions, microwaves, cooking, in all of the iPods, iPads, these things where you get from where you can read a book. I forget what you call those. And computers. Probably, and then I learned just recently, I have a car, a Prius, Toyota Prius, and I forget what you call those cars, but these are cars that have a lot of computers in them. And the report was, and it was in the New York Times, must be true, that these cars are dangerous because of the radiation, especially to the passenger. So it's everywhere, and we're surrounded by radiation. We're probably using it right here as we talk. And so it has become increasingly clear to me that we're living in a sea of radiation. And I just so happen to have had a tool, which was this particular pulse system, which alerted me to these things earlier than people are able to recognize it. So one of my colleagues, Ross Rosen, and I published a paper on this. It was published in the American Acupuncturist, which is the journal that represents the profession, the acupuncture, Chinese medical profession in this country, called The Pulse, the Electronic Age, and Radiation Early Detection. The original question was, how did you come to discover that toxicity is a major problem affecting the general population? As I said, patience, essentially.